Emerging biomedical technologies have the potential to revolutionize healthcare and improve human health. These range from portable hemoglobin meters and ultrasound machines to new water filtration systems. A key barrier for entry for these new emerging technologies is understanding the complexity of the innovation process. This isn't just issues of the product development process, but also issues of access and capacity within the health system. Innogen research into existing biomedical technologies highlights the multiplicity of factors that impact, because we take a novel social science-based approach. So, while most of the world is making progress to reduce poverty, disease and hunger, Africa is still suffering more than most. Africa has the highest levels of childhood diseases, especially pneumonia, diarrheal disease, as well as diseases such as malaria, TB, and lesser-known diseases such as hookworm and Chagas. Africa's fight against HIV/AIDS is perhaps the most well-known, with some countries on the continent having 1 in 4 people infected. But it's not a totally negative story. Slow but steady progress is being made. And one of the reasons for this is the level of innovation taking place. New drugs, vaccines and diagnostic tools are increasingly being developed, such as being put in place in hospitals such as this one. In fact, the hospitals in this picture in Kilifi in the coast of Kenya is home to one of the world's leading malaria research centres. It has done pioneering work on malaria drugs, as well as on issues as how to improve the diagnosis of malaria and to improve hospital care to the most severely infected. One of the reasons that this is possible is because of the emphasis placed on local capacity building to research and study disease. Innogen research has shown that building up human research in one research centre can lead to the creation of new research programs and new research opportunities and feed the establishment of new research centres. Our work on HIV vaccine research in Kenya highlights how research centres that conduct clinical trials on potential vaccines, even when trials were not successful, create a pool of talent that has since gone on to work in clinical trials for other diseases and vaccines in different research centres in the country and in the region. But none of this is, but Africa isn't just conducting clinical research. It's also increasing its manufacturing base. This is a picture taken by a colleague of mine of drug manufacturing for HIV/AIDS in a factory in Zimbabwe. This factory is developing these drugs so that the country does not have to simply rely on expensive imported drugs. This is important capability for the long-term success of reducing disease and improving the economies of African countries. Innogen research has shown that it's essential for African governments to create an enabling environment to allow science, technology and innovation for development to thrive. This is necessary to reduce the health inequalities in the world. This is my daughter in a UK hospital being treated for jaundice when she's just a day old. In many countries in the world, this type of expensive equipment that's required to produce the blue light to treat jaundice is not available. But some countries are developing new and cheaper solutions, such as this one, which has been developed by a Uruguayan scientist and is now being marketed by that scientist for export around the world. And it uses lots of tiny blue LED lights in order to produce the light that's required to treat jaundice. In fact, the process of reverse engineering, where technologies pioneered into the developing world are taken up by countries such as the UK, is happening and increasing all the time. Perhaps the best well-known is the Tata Nano car from India, but in the healthcare field, it's General Electric's handheld ultrasound machine. One of the key elements to this success is building an enabling environment, which requires a changing mindset by policymakers. Innogen spends lots of time working with policymakers, such as at this workshop in Kenya, in Nairobi, to understand what innovation is and how best to promote it. Considering the enabling environment isn't rocket science, however. In fact, you'd think it was pretty obvious. But often there are many obstacles that stop policymakers from being able to think broadly about what is needed to maximise the health and welfare of their country's citizens. These include limited budgets for health. Many governments in Africa have health budgets that equate to less than £10 per person. It also includes other more pressing problems such as war and conflict, or other competing policy areas such as natural resources and exploration and mining for oil, gas or gold. But some countries are making progress. Science and technology and innovation for example, is centre stage in Kenya's Vision 2030 document, which is the nationwide strategy for the country's economic and social development over the coming years. Rwanda is making progress with its health budget per capita, which is now nearly double that of many of its neighbours. Ethiopia and Malawi have benefited from working with international partners to train their healthcare workers, particularly at the community level, including in Malawi's case with partnership with the Scottish Government. In addition, Africa is a hub for innovative and entrepreneurial talent. Africa was the birthplace of mobile money transfer, and some would argue crowdsourcing software, and even three-wheel baby strollers, if you're to believe the story I heard just recently. And hundreds of people are developing new ideas every day. The success of mobile phones in Africa has led to mobile phones being used in healthcare as well, to try and increase the adherence to drug treatment, for example. And this is another example of a system that is now being used in the UK and the US and Europe to try and treat illness and, for example, public health activities such as smoking cessation. What is needed now is sustained effort by policymakers, communities and businesses, supported by academics, to ensure that Africa can build up its manufacturing base in a way that supports the health and welfare of its citizens to continue to improve access to affordable healthcare. A key element that's necessary to ensure that this sustained change happens is through continued use of social and economic research and policy advice, such as that provided by Innogen.